You PTs that are used to doing manual muscle tests, how much different is doing neuromuscular facilitation than manual muscle tests? Okay, you guys are the ones that have the hardest time breaking bad habits. So if we're looking at vastus lateralis, we're checking vastus lateralis for neuromuscular function. Keys are make sure that we are not in range of motion. If we test something in range of motion, we're going to get either active insufficiency or passive insufficiency. We want to be in mid-range of motion. Make sure that our force is going in the plane that we want to be going in. So remember, vastus lateralis is a hip rotator, knee flexor, pronator, so controls pronation. So we need to take them through that plane. Make sure that our hand placement and that we have them in position before we give them the force. Okay, so we passively put them in position, then we give them a very specific force in a very specific plane to test facilitation. So now compare that to what you learned in PT school as far as manual muscle tests. Put them in a position and just force them as hard as you can. All you're going to be testing there is compensation. And you're not testing vastus lateralis versus medialis versus rectus fem versus genioarticularis. All you're doing is checking deflection and compensation. Okay, so all of your positions, so lateralis, medialis, genioarticularis, intermedius, rectus fem, make sure that you're putting them in position, you've got the position, and you're pushing them through the plane that we're testing.